India's COVID numbers have reached record highs with over 3,000 deaths daily. Over 200,000 have died since the pandemic began. Now, the international COVID hotspot, the pictures coming in are heartbreaking as hospitals are overcrowded and oxygen supplies are low. Ramchand, Saranu, and Tehmina, Arora join me now. Thank you both for joining us today.
Thank you.
Thank you for having us.
Tehmina, maybe I'll start with you. What have you been witnessing on the ground there in the country?
Well, I live in Delhi, and some of the scenes, a lot of it we're consuming on social media and through the news, but it's just like you said, heartbreaking. So many of my friends, you shudder to pick up your phone because every time it pings, it means either somebody's asking for oxygen, asking for a bed, asking even for cremation spots and graveyards. It's just so distressing this time.
Ramchand, people are dying, as Tehmina just said, people are dying while also even waiting to be seen by doctors. And as I said, oxygen supplies are low. How are people getting help if the hospitals are filled to capacity?
Yeah, that's a major problem, and there are no oxygen even in the biggest hospitals, even in Indore city. I live in the central part of India. Even the corporate hospitals have no oxygen. I just sent one of our staff to Mumbai to get 10 oxygen cylinders by ambulance. So we are trying to help some of the patients in a kind of a home setup and giving oxygen through these cylinders. And also we are trying to order more oxygen concentrators, but it will take more time to get those concentrators.
So are you saying in the orphanage that you run that you're making that almost a makeshift hospital? Is that what you're doing, Ramchand?
Yeah, not the orphanages, but we have a training centers. So we already made one training center as a kind of a COVID relief center, but mainly the staff of different NGOs are there because we are not allowed to take strangers without government permission to run the COVID relief center.
Tehmina, with India being part of the top 10 world buyers of the vaccine, are people getting the vaccine? I mean, I've heard of accounts of people paying over $1,000 to get the vaccine on the black market in India. I know that a lot of people, millions of Indians have gotten the vaccine, but there's still so many more who haven't gotten it yet.
Yeah, absolutely. We've only vaccinated a very small percentage of the population. And the vaccine is, like you said, in really short supply. It's being sold on the black market. But even just registering for getting the vaccination, for instance, till recently, only 45 and above were able to register with the government portal, apply to get this vaccination done. And recently, after you saw this huge surge in the number of cases, the government said, all right, any above 18, could register. And the government portal then crashed, and people are not, so even if you do manage somehow to get onto the application, register, it now shows you that there are very few centers where you can actually go and get a vaccination. So we are really struggling even for vaccination at this moment.
We're also hearing of crematoriums that are full and people cremating their families' bodies on their private property, allowed to do that as well. Ramchand, what is that site like? I've just seen some video and some photos of just so many small fires around the country. I know crematoriums have also extended their area so that they can cremate more people. Paint a picture for us of what that looks like and smells like every single day.
Yeah, I think there are many cities are facing the same challenge. Many of them, it's kind of they're burning the bodies in kind of a mass numbers. Even the graveyards and also having go out of space, even in the smaller towns, not only the big cities, even the small towns also facing same problem in the graveyards and mass burning of the bodies. We have never seen that, at least in our life.
Yeah. Tamina, I mean, there was a point where India was doing a lot better. Come December, I mean, the country thought that they had really skirted a lot of the high numbers and the numbers were going down. And then all of a sudden, we've seen this surge of now so many people contracting the virus and dying. What has happened? I know a lot of the restrictions were lifted. Are people saying that that is the reason why we're seeing these high numbers of deaths all of a sudden?
Absolutely. The restrictions were lifted, and what we did not do was fully prepare to meet the surge. Everyone was predicting it was coming. All the lockdowns, all the restrictions were only meant to buy us time so that as a nation, we would prepare, we would make more hospital beds, we would ensure that there was enough oxygen, medical supplies, vaccination. But in so many ways, we failed as a nation to prepare. We did all the lockdowns initially, but if you don't prepare, you're only pushing it down the road. And that's exactly what has happened. As the restrictions lifted, you saw more people gathering in the streets. And if you think about what some of the statements, very senior leaders in various political parties, even in the bureaucracy, making some very irresponsible statements, and with their own, large gatherings, you're telling the people it's okay, we had several ministers say, Corona's gone, there's no need to worry. We've done it as a nation, giving ourselves a pat on the back when really we just kicked it down the road and not prepared.
So Tehmina, on that note, what do restrictions look like now? Are people staying in their homes? How are people staying away from contracting this virus?
So it's very mixed in many cities, in many places, also depending on whether we have the privilege to be able to stay at home. I have the luxury to stay at home. I can order my groceries in, my vegetables in, etc. But not everyone has that luxury, and people are forced to go out, even to just earn a daily living. And you've also had a series of very large public gatherings, religious gatherings, which continue, and election rallies. So it's been a very mixed bag. So in some places, yes, people are staying at home, they're being careful, but on the large part, sadly, even now, not.
Ramchand, I want to go to you. How is your orphanage doing and the work that you do? I know you work very closely with persecuted Christians in the country. Actually, both of you do, but would like to hear how your orphanage is doing, how the children that you take care of are handling this. Have you lost anybody because of this virus?
Yeah, no, Maggie. Only one of the couples that works in the orphanage, and they are COVID positive, and we shifted them from the home to training center where we have a lot of patients. And these couples are early 60s, and we are taking care of them. So far, they're good.
And a last question, how are both of you seeing God in the midst of all this? I know that both of you, again, work so closely with Christians in this country, and you're both believers. How have you seen God work throughout all of this pain? Maybe I'll start with you, Tehmina.
I think it's a difficult time. I know when we see terrible suffering like this, it's very natural. I've lost friends, I've lost, not immediate family members, but close. And you do question, where are you, God, in all of this? And what is it that we should be doing as a nation? And I know, at least from my own self, I believe that God is a good God, and his heart is pained by what he's saying. But it just really shows to me that how broken our systems are, and how much as a Christian we need to work towards building these systems, so that what is killing people just now is not COVID, it is a complete lack of preparation. If hospitals were in a better space, people would be saved. And what does that mean for me as a Christian? How do I respond to that? So it's really a challenge in that sense from God to all of us. What would you do in the face of such suffering? Because he's a good God, and he wants to alleviate this suffering. Yeah.
I appreciate your honesty in that. How about you, Ramchand?
Yeah, during this time in the second wave, mainly lost a lot of my close friends, even the pastors. It's very, very painful situation. And even my wife was going in depression by hearing all the deaths. It was kind of a lot of pain. But I was reminded by the verse in Isaiah 55:8 that God says, our thoughts are not his thoughts, means our ways are not like his ways. Even though not able to understand what was happening, and but that verse gives a lot of comfort. And so, as Tehmina said, it's a system that we were not prepared. The political leaders were very negligent, and they were blind, and they were not able to prepare the things well. And so now all the common man is facing all the consequences of the system that was in India.
Yeah, the collateral damage of poor planning. Thank you so much, both of you. We will be praying for our brothers and sisters in India through this difficult time. Thank you.
Thank you. Thank you, Maggie.
Thank you.